Welcome in, everyone. Our podcast as we bring you the best of Sports Medicine Weekly. Brand new show for us. In this one, I'm Steve Cashel with Dr. Brian Cole. Dr. Cole, of course, the head team physician with the Chicago Bulls. Long time efforts there. And, of course, one of the team physicians with the Chicago White Sox. Sports medicine specialist, orthopedic surgeon from Midwest Orthopedics at Rush. Our website is sportsmedicineweekly.com. Let me begin with this. What if the best way to treat your pain is to start with physical therapy? The same athletico therapists who work with world-class athletes and professional dancers can transform your pain before it progresses to something worse. Schedule your free assessment at athletico.com. It all begins with Athletico. Dr. Cole, how are you?
Steve, I'm doing great. I'm loving the podcast format. First couple ones that we just started doing have been awesome and getting some great feedback. So this is a lot of fun, and I think I like it a lot better than terrestrial radio. Absolutely.
We've got a great guest with us in this podcast, Dr. Cole. He is Dr. John Grant, a sports medicine, knee and shoulder surgery specialist, assistant professor, med sports, University of Michigan, also the head team orthopedic surgeon for Eastern Michigan University Athletics, and a team physician for USA Hockey. And that's one of the things we're to be discussing about is hockey injuries. First of all, Dr. Grant, thanks so much for joining us here on Sports Medicine Weekly.
Great. Thanks so much for the invitation to talk to you guys tonight about a sport that I'm really passionate about and have been since I was a small kid. So this is a great opportunity here for sure.
Dr. Grant, do you mind if I call you John, or you can call me Brian?
Sure, please
okay?
do.
We'll keep it casual. I would just love to, Steve did a great introduction for you, but just, get a little sense of your background and how many years you are in practice, and give a sense of what you do day to day.
Sure. I'm originally from Canada and actually did most of my training there, including grad school and residency in orthopedic surgery, and then ended up with a fellowship in sports medicine and shoulder here at University of Michigan. Ended up heading back to Canada for a couple years of private practice before coming back to join the faculty here in 2014. And so more recently, over the past number of years, I've been focusing practice a little bit more in complex knee, cartilage transplants, complex knee joint preservation, and those types of things from a clinical point of view, but also interested certainly in the care of sports medicine athletes across the wide spectrum, and especially here at the college level, and more pertinent to this talk show here tonight, the USA National Team Development Program that's run just a little bit east of us here in Plymouth, Michigan. So great fun hanging out with those guys over the past 4 or 5 years and taking care of them, these high school players in 11th and 12th grade, really coming from across the country to come together here for some high-level training to compete, ideally for USA on the world stage for sure. So it's been a great excitement and benefit for me being a hockey player ever since I was a little kid, to both watch these guys play at an amazing level and take care of the various injuries that occur with them over time and help support them and get them back on the ice so they can be the best players they can be. And really, it's an interesting time to be with them because this is a run up to their NHL entry draft and moving on into college and then hopefully professional careers. So it's really a pivotal point in their lives to be both developing as sort of mid-teenagers, but also developing their hockey skills and camaraderie with their teams and building forward. So it's a great time to be with these guys at the high school level. What's
interesting is you get the benefit of having been a hockey player, and I can tell you I was not a very good basketball player, and I used to strike out in t-ball. Okay, so an awful baseball player, yet those are the two sports that I take care of. The only sport I really played was football, and I would have loved to have taken care of a professional football team just because I completely identify it. But I will say I've truly enjoyed both of those sports and getting to learn them, and now I've become a big fan. But it's got to be something special when you have it in your sort of heart and soul, and you played hockey probably since you were very young, knowing where you grew up, right? And now you get to you can share in how these athletes how they're motivated, and these young people who try to get that balance between they're in school at the same time and then they're trying to balance their sport. So I am sure it's really a wonderful aspect of your career.
It's interesting. I actually have the opposite experience. When I came here as a fellow, I had really had minimal experience in football. And of course, I had to learn, American football and getting used to all the rules and stuff because I never really played it. So now being the sideline physician for the Eastern Michigan football team in the fall, I had to learn all that when I came here. But certainly, as you said, the hockey's really been a great joy for me. I've now got to bring my kids to some of the hockey games at night and get them to sort of follow along and see the players. And it's nice to be able to identify, a little bit with the injuries and be able to follow the play and then the challenge that they've got. But I think you're right. They have a special system here with their schooling. So they're studying during the mornings, they're training in the afternoons. These guys are playing in the USHL hockey league, much like the Chicago Steel that Rush also takes care of. So they're traveling a lot during the week and weekends. So a lot of demands on these high school kids and stresses being away from home. But they come together really well, and to see their camaraderie and their development over the couple of years that they're here, learning to play together as the elite players in the top of the country, really, and travel internationally, and that affect's a big deal for them. And being able to help support them is a big deal.
I want to ask you both, Dr. Grant first, then Dr. Cole, about some of the more common injuries in hockey. Well, I don't know where to start. And obviously in the NHL, they talk about upper body, lower body. They never get specifics. The only sport that you don't know that is it an ankle? Is it a knee? Is it a shoulder? Is it an elbow? They hide that pretty well. I want to discuss that maybe a little bit. But first, Dr. Grant, what are some of the more common injuries you see?
Yeah, I think it kind of depends. There are some injuries that appear kind of across the spectrum from younger players up into professional players. And then there's some different injuries that are a bit more specific to the levels of play. I think overall, certainly concussions are a big issue. And I think there may be other discussions on this podcast at other times about concussions, so we won't go too much into that. But, the issue of concussion and cervical spine injury is certainly a real issue. We can come back to that a little bit. Other than that, upper extremity is very common. Things like shoulder separations, shoulder dislocations, clavicle fractures, or collarbone fractures. And then in the lower extremity, knee injuries or medial collateral ligament injuries are very common as well. Moving down to the ankle, high ankle sprains, certainly where they've got this rigid boot on. If you can get caught in a rut or get tangled up with another player, you can get a sprain of the syndesmosis or the higher part of the ankle, which unfortunately is a longer recovery time than the standard ankle sprains.
One of the things that I've seen pretty common, you can correct me if I'm wrong, has been a preponderance of groin injuries in hockey players. We occasionally get these sports hernias, which are different than the traditional hernias, but truth be told, is that a big thing that you're seeing in this age group? Maybe it's a little bit younger than what we see in NHL and so forth. But what are your thoughts on that?
They certainly, anything around the pelvis is certainly an issue. So things like osteitis pubis, groin injuries, as you mentioned, sports hernias. We do these pre-participation physicals every year when the new players come in, and almost every single one of them's got super tight hip flexors that can sometimes cause a little lower back issues as well.
Steve, I know you have two young boys. Are both of them playing hockey? And if they are, what have they had any injuries that are kind of unique to their? It's a pretty young age group, I know.
Yeah, I've got two boys, 14 and 16. My 14-year-old plays baseball, basketball, football. He used to play hockey, but doesn't play hockey anymore. My 16-year-old used to play baseball, basketball, football, quit everything to just play hockey full time, and he made the AAA level. There's only 4 teams in Illinois that are AAA, so he's at the top really of his age group, which is tremendous. He's a junior in high school and playing at a very high level, and he did suffer a wrist injury, broken wrist. Dr. John Fernandez from Midwest Orthopaedic Surgery did a marvelous job, and he found out it was a 18-month-old injury that was misdiagnosed, and so he knew it was bothering him, and then he got slashed in front of the net, and they found out it was the scaphoid bone that broke, and so he had a pin inserted 4 days later, and they had to do a bone graft to fix the first injury, but 7 weeks later, he's on the ice. He's nearly 100% again. Just some ugly scars, but he's doing great. And Dr. Fernandez did a wonderful job, but that's really the only injury he has had in probably over 10, 11 years of hockey.
Yeah, the scaphoid is this tiny bone in the wrist, and these things get missed all the time. And like you say, he was probably skating and playing with that for a very long time until it saw the light of day. And it's amazing he got back at 7 weeks. That's pretty impressive.
Yeah, well, your guys at Midwest Orthopaedic Rush, I mean, you had the bone stimulator. Am I saying it right?
Yeah, that's right.
Yeah, which helped. He was on calcium pills and really took it easy. It was very hard emotionally for him, mentally and physically. Couldn't really do much, but did what he needed to do. But he was back on the ice, and then he did the MRI once again, and the CAT scan and the X-ray, and it looked like it was fully healed. And Dr. John Fernandez said, "Go ahead, you're ready to play," and he's been playing ever since. So that injury occurred back in the last weekend in October 2020, and he had surgery November 4th, and back on the ice right before Christmas. And it really, really worked out very well. So we're very happy. Awesome. And as I said, you're going to be better off now than that injury that was lingering, right? Is that how you guys see it?
Yep. That's like the Tommy John problem. You don't know how bad you are until you get it fixed. John, so I know you're the head team physician for Eastern Michigan University Athletics, and I know hockey is your mainstay as a team physician. in basketball, we often enter into these injury prevention programs specifically to things that kind of happen a lot in basketball, like ACL injuries. So those are sort of the low-hanging fruit for injury prevention. What about on the hockey side? Is there anything that the strength and conditioning guys do to help these young athletes remain injury-free?
Yeah, so I think one of the things that we work on specifically in hockey is as we do the pre-participation physicals, we try to pick up anything that the players come in with for sure. I think the hip flexor tightness is something that I sort of harp on with the athletic trainers and the strength guys a lot to try to get those worked out a little bit to avoid some of these groin injuries, low back issues, things like that. I think that can pull and on the pelvis, which is really the core of your skating ability. So we work on that for sure. They've got the USA Hockey built a great training facility here when they purchased the rink from CompuWare and their previous OHL team that played there. So got a great training facility to do explosiveness on ice and off ice, whether it's in the shooting room and things like that. But injury prevention, really, these guys are coming in and they've got a very, for the most part, have a very young body coming in as 15 and 16-year-olds over the course of those 2 years, kind of transitioning and building strength and endurance to really play at this level. These 16 and 17-year-olds are playing most of their league games in the USHL. So they're playing against guys who are 18 to 20 or 21. And so being able to pick that up, I think, and learn their quickness to be able to keep their heads up, I think is the biggest thing for injury prevention to be able to tolerate to play at that level. But the playing every day, practicing on the ice, working out in the gym, and having the coordination between the athletic trainers and the strength coaches, which is really an important liaison and communication to make sure they're on the same page, both with transitioning guys from injuries to back to health and the healthy guys to keep them healthy. So that's really important there that way.
Dr. Grant, I did want to ask you this. You brought up the knee. More contact when there's knee injuries, is that more through contact or non-contact in the hockey space?
Yeah, so interesting. I think the injuries go both ways, right? In hockey, you've got, especially at the higher levels, you've got the contact and the checking, both open ice and against the boards. A lot of the knee injuries, especially the MCL injuries, the higher percentage of those certainly do tend to be hits. A lot of times they're either being pinned against the boards and their knee gets hit a little bit low, or even with open ice hits that can happen. So certainly I think a lot of the contact injuries here are the cause of most of the MCL injuries for sure.
JRF Ortho partners with orthopedic surgeons to improve the quality of life of patients by enabling them to have an active life through the generous gift of cartilage and ligament transplantation. Please go to jrfortho.org to learn more or sign up to be a tissue donor at donatelife.net. And they're one of our sponsors, JRF Ortho. And Dr. Grant, I wanted to ask you about your participation and synergy with JRF Ortho and how they play into your practice.
Yeah, I think JRF Ortho has been a great liaison, and they're very, very promotional with respect to helping educate surgeons and also make the link between, tissue donors and their recipients. I think they play a great role in connecting the great gift of life and gift of tissue that donors play to allow, especially in our practices, similar to Dr. Cole's, these young athletes and these young individuals who are significantly debilitated by joint injuries and cartilage injuries, that we can sort of bring back and get them back to their activity levels by transplanting this healthy cartilage, primarily into knees, but sort of expanding into other joints, and partnering with them and being able to help these patients as soon as possible and really take full advantage of all the gifts that the donors give, I think is really important. And they play a great role in that for sure.
And I've got one more for you. We kind of left that out in our early conversation in this podcast, Dr. Grant. Upper body, lower body. Do the colleges and the high level junior programs use the same terminology? I mean, in NHL, again, we don't know if it's an elbow or a knee, lower body, knee, or ankle. They just say lower body or upper body. Why do you think they're so protective of that? The NHL allows that.
It's kind of interesting why it's much more in hockey than it is in other sports. I'm surprised it's not more in other sports. I think a little bit is protection, certainly at the younger levels. People are worried about where they're going to go from here. What other players are they advancing to the next level, drafts, and what their injury histories are. But also it's sort of a media thing. So things in the NHL, everyone wants to know what the information is, same with other pro leagues. And some players just want a little bit more privacy. And they want to be able to recover from these. Hockey players are pretty tough people. They take bumps and bruises. Injuries can go under, and they can rehab them quietly and get back pretty quickly. And so the hockey players are pretty resilient. They don't want probably want this moniker on them. They have this injury or that injury. They just know they got a little bit bumps and bruises from a game. They're going to take a little time to recover from that and get right back going as quickly as they can. And so it tends to be really just the bigger injuries that are going to cause long-term time loss, whether from surgery or recoveries, that eventually come to the light of what they need. But these guys are pretty protective. They're pretty proud and they're pretty hardy, and they like to get back on the ice as soon as they can, and don't want to be dragged down by this injury or that injury and have people kind of pontificating and trying to guess what their return to injury or their return to play time is and how they're going to be affected when they get back. They just want to get better and get back on the ice and contribute to their team. And so they don't want to be weighed down by these types of things, I think.
Yeah, and to your point, there's very few athletes that you can close a laceration without local anesthetic. That's what a hockey player does, right?
That's true. They come off, you ask them, do you want some, local anesthetic for your cheek or for this or that? And they're like, do I need it? And I'm like, well, no, just suck it up. We'll sew it up and we'll get you back on the ice. And they're like, Shine, just do it. Okay.
Yeah, that hasn't been my experience in non-hockey players, but it is, I think it's fascinating to see how different athletes, their temperaments in terms of their ability, willingness, and so forth to suffer.
Yeah.
And hockey players are a unique breed.
Yeah, it's interesting. I mean, there's even differences, as you mentioned, between different sports, basketball, football, and hockey. But with hockey, for sure, if you tell them you got to miss a couple days for this or that, and they're like, what do you mean? I just got to go out there right now. I've had kids who get lacerations, and as Brian said, as soon as you're sewn up, all right, I'm ready to go. I'm putting the skate back on, right? And I'm like, okay, let's see how it goes. Just don't bleed out through your skates, so it should be good.
Good stuff, guys. And we'll leave you with this. Dr. Grant, hopefully you have tried or will try Karen Malkin's new protein brownie bar and superfood bars, best tasting bars on the market, certified gluten-free, paleo, no added sugar. Karen's protein brownie bars, superfood bars, available on Amazon and at Karen Malkin, MALKIN.com. Dr. John Grant, great stuff. We really appreciate you joining us. Again, Dr. Grant, Associate Professor, Med Sport, University of Michigan, head team Orthopaedic Surgery, Eastern Michigan University Athletics, team physician, USA Hockey in their developmental program. Thanks so much for joining Dr. Brian Cole and I here, Dr. Grant, on this podcast.
Thanks for the opportunity to be here, and I appreciate the invitation.